Hello, and welcome to today's National 8A Association webinar. The National 8A Association is a nonprofit with a mission to provide education and guidance for all aspiring, current, and graduate 8As. We are so proud to work with all types of minority small businesses, agencies, large primes, and industry professionals. Before we begin, I'd like to know that this webinar is being recorded and all presentation materials will be posted on our website. If you would like to ask a question, please use the Q&A or you can email us at events@national8aassociation.org. I'd now like to introduce you to today's speaker, Ariel Douglas and Joshua Blow with the Department of Health and Human Services OSDBU office. Please join me in welcoming Ariel and Joshua as they dive into doing business with the Department of Health and Human Services. Thank you both.
All right, great. Thank you for that introduction. We are definitely excited to participate in this webinar today. We know that this is the fourth quarter, many transactions and actions happening. So we definitely appreciate the time you have taken to jump on this webinar today on how to do business with the U.S. Department of Health and Human Services. So just wanted to provide an overview if many of you may or may not be familiar with the U.S. Department of Health and Human Services. The overall mission of HHS is to enhance the health and well-being of the American people. So we touch everything from when a person is born, anything in between, and then, till their ultimate last day of breath on this earth. So, we are involved in many health and human services to all of the American people. Within HHS, we actually do have 13 separate contracts, 13 different contracting activities. And we kind of refer to our program offices as our HHS operating divisions and our staff division. So many of you probably are familiar with, sorry, I'm trying to go to the next slide. I think it's stuck. Okay. All right. So many of you may be familiar with the Food and Drug Administration, the Centers for Disease Control and Prevention, our National Institutes of Health. These are considered to be our HHS operating divisions. Again, all of these divisions have their own contracting shops, their own mission, their own budgets. They're all buying different products and services. And under our Office of the Secretary, we have what is considered to be our staff divisions. And these are offices that report directly to the Secretary of HHS. And there is one contracting shop that conducts the acquisitions for our staff divisions, and that is the Office of Acquisition Management Services. Many of you may be familiar with them previously being called the Program Support Center. So again, each of the staff divisions, they have their own mission, their own budgets, and are purchasing a variety of different things. Here are kind of some of the primary mission areas within HHS. As I mentioned, we do a lot of human services. We do IT acquisitions. We do purchasing of vaccinations and treatment of diseases. We have, some construction projects under our Indian Health Service, as well as our National Institutes of Health. For our refugee programs, this would probably be under our Administration for Children and Families, as they are dealing with individuals that are crossing the border. Our research and development arm specifically would be with the National Institutes of Health, as well as some with the Food and Drug Administration. Our Indian Health Services is primarily focused on tribal health affairs and activities surrounding that. And then our research and healthcare quality services and delivery probably would be with our AHRQ. Wanted to provide kind of a spend breakdown from FY23 as it relates to what was the total amount of spend between our operating and staff divisions in FY23. As you can see, the Administration for Strategic Preparedness and Response, also known as ASPR, had the most amount of spend in FY23, coming in at about $9 billion, with the Centers for Disease Control and Prevention coming in second, as well as NIH coming in third at about $8 billion. So this spend is consisting of large businesses and small businesses. So again, as a whole, last fiscal year in 23, the department spent about $40 billion on contractual actions, and $10 billion of that going specifically to small businesses. So we hopefully will be on track to spend that or even more in FY24. Wanted to briefly touch on our top industry NAICS codes. And again, this is of spend inclusive of large and small businesses. As you can see, the pharmaceutical preparation and manufacturing had about $5 billion of spend. And this is exclusively with ASPR and CDC. Coming in second was our research and technology and biotechnology at 4.5 billion. And then coming in third is computer system design services, which are kind of those IT specialized services, come at about $3 billion. HHS, again, does a lot of work with small businesses and wanted to highlight what the small business industry NAICS codes for FY23. IT services rounded out number one at about $1.3 billion, with other computer-related services at 1.2, and kind of that general professional services rounding out 3 at $810 million. So again, if your company has core capabilities in any of these NAICS codes, there's definitely work for you here within the department. Wanted to just highlight some of the HHS resources I like to typically provide to small businesses looking to do business with HHS that are not familiar. So we have our HHS equity plan, which does lay out our action plan relevant to increasing opportunities for small disadvantaged businesses. Our FY24 budget brief. This will be updated in 25, but typically I recommend businesses to take a look at this document to kind of understand which programs are being funded and have budget for the forthcoming fiscal year, because it's no point to be pursuing opportunities in a program that may not have any funding. You want to make sure that if you are pursuing opportunities, it is with programs that have actual money that's tied to it. And then our strategic plan, you have to kind of know the direction of the agency and some of their priorities. So understanding what is outlined in our strategic plan will definitely be a foundation for you to kind of understand where exactly we're going and some of the planned activities we have between these two fiscal years. Well, these span of fiscal years. All right, so again, me and Joshua both work for the HHS Office of Small and Disadvantaged Business Utilization. If you have an interest in doing business with the department, I recommend that our office be your first stop. We are actively ensuring that small businesses are considered for procurement opportunities within the department. We spend a lot of time on outreach, being involved in policy updates, and training small businesses as well as our internal stakeholders on how they can maximize opportunities for small businesses. These are our strategic objectives. Again, we are ensuring that our department furthers the mission of the small business program as it relates to the set policies, either internally or external federal regulations as it relates to the small business programs. We're focused on improving the points of entry and reducing the barriers for small businesses looking to do business with the department. And then, as mentioned, we have a coordinated effort to make sure that we are actively involved in outreach activities to include with the National 8A Association, to make sure that we are having partnerships to be able to reach small businesses who are looking to do business with the department. These are our focus areas, and the acronym for this is GPSS, which stands for growth, predictability, synchronization, and sustainability. I'll kind of hit the high points on this slide. We have identified that there has been a lack of small businesses doing work within HHS, within the manufacturing, innovation, and knowledge-based services areas. So we are looking for small businesses that are in these three areas to, potentially increase the industrial base into the department. And again, we also have a focus on a growth in new entrants. This FY, we established a new webinar type series called Grow with HHS. And this specifically was a focus on reaching those new entrants that have not done business with HHS, but are looking to do so, and kind of just providing them the foundational information on how to have success with the department. So that will be something that we will continue in FY25. Next up, predictability. About 2 fiscal years ago, our deputy secretary issued a memorandum to our acquisition leadership, as well as just overall leadership within HHS, designating our small business customer experience as the system of record for our forecast. So since then, we have been focusing our efforts on making sure that we have the most accurate information in our forecast as it can be. As you may know, trying to get people to have the correct information has been a slight challenge for us, but we have been making some headway and do believe that this is a good tool for acquisition planning for businesses when they are looking to identify potential procurement opportunities within the department. Synchronization, definitely want to make sure that we are continuing our partnerships with industry and making sure that we continue to have open communication with our optives and staff diz as it relates to what their needs are relevant to small business potential requirements. And then the accountability piece, we've been focusing primarily on in this area on holding our large primes accountable for what they are saying as it relates to their small business subcontracting opportunities. November of last year, we hosted our first large prime contractor summit. We brought in many of our large primes to kind of have a very transparent conversation with them about some of the challenges that they may be facing, as well as some of the challenges we've been hearing from small businesses as it relates to subcontracting opportunities. So we have been having much success with meeting with our large primes to make sure that they are doing what they say they're doing and holding them more accountable as it relates to their small business subcontracting requirements. And then lastly, sustainability. We're making sure that we're standardizing some of our small business processes within the department, and then making sure that we are continuing to educate either internally and externally to make sure that we are able to sustain some of the momentum that we've had as it relates to small business success within the department. So meet the small business OSDBU team. This is my amazing team here that I work with each and every day. We did take a picture during our Small Business National Training Conference that took place in April of this year. So super excited about the OSDBU team. Within our office, we have 3 divisions. The first 2 are policy and administration and outreach division. Again, policy deals, this is where our subcontracting program manager sits, and they have the responsibility for working with our internal stakeholders on different small business policies, either federal or just internal to HHS. Administration and outreach, this is the division that has a responsibility for our training, outreach with industry, any kind of events. If we're being invited to an event or either hosting an event, they are the ones primarily focused on those activities. Within our office, we have at least one small business professional that is assigned to each of the operating divisions. On this slide, you'll be able to find all their information to include their name and their email. So again, these are the individuals that you would want to stay very much in contact with based upon your interest with HHS. Typically, if you are wanting to do business with HHS, I say focus on about 2 to 3 operating divisions that you believe best fit the core capabilities of your company. No reason to chase opportunities with all 13, but kind of narrow your focus on those 2 to 3 operating divisions where you think your core capabilities best align. And these individuals would be your first initial point of contact if you have an interest with those specific operating divisions. We do host monthly outreach events. So our first is our monthly vendor engagement sessions, which are held on the second Tuesday of each month, and then our monthly office hours. So our vendor engagement sessions are where you have the opportunity to schedule one-on-one meetings with the small business professionals that are assigned with each of the optives. And then our monthly office hours are focused on, we bring in an optive operating division each month for them to kind of come and brief to small businesses about some of their initiatives and strategies, as well as any forthcoming procurement opportunities that may be coming out of their office in that particular fiscal year. So these will start back up in FY25. We anticipate them starting off during the month of November. So I recommend that you go to our hhs.gov/OSDBU or visiting our small business customer experience on how to get registration information for those 2 events. And definitely could not, have this presentation without giving a big thank you to the National 8A Association, as well as the National Hub Zone Council for recognizing HHS as the Agency of the Year during its most recent Small Business Industry Awards. We were super excited about the honor and definitely are excited about the work that we've been doing with both of these organizations and appreciated the recognition this year. All right, so just wanted to hit some small business achievements from FY23. As I mentioned, as a department, we did spend about $10 billion with small businesses in FY23. We did achieve 3 out of the 5 small business goal categories. We did not meet the service disabled veteran-owned small business category, nor did we meet HubZone. But it's happy to say that we did have increased spend in all of the categories. So we are hoping to be able to achieve 5 of the goals in FY24. But as you know, much of the spend is happening in the fourth quarter. So we are actively monitoring our small business goals each day to kind of see where we are going to land for FY24. Just wanted to provide some highlights regarding the 8A program within HHS. As you are aware, there is not a separate goal for 8A, but it is combined with the small disadvantaged business socioeconomic goal category. In 23, we had about $2.8 billion in prime 8A contract awards. There were about 1,024 different 8A firms that received contract award or some type of contractual action in FY23. Under that, we did about $8.76 million in 8A sole source awards. And then competed 8A awards was about $281 million. So again, our agency, our department is very well versed in kind of how the 8A program works. So again, if you are 8A looking to do business with the department, this is the place for you. Just wanted to also highlight the top 5 NAICS codes where 8As preponderantly did a majority of the business in FY23. As you can see, it was a mix of IT as well as professional services. Here are our HHS top contract vehicles. Again, depending upon how the market research and the acquisition strategy, the contracting officer will determine what the best contract vehicle that potentially will be used for the procurement. This year, the department did issue out its small business category management strategy. So we're excited to see, that there is some synergy between category management and small business within the department, which was not necessarily there before. We also oftentimes get questions or asked, are there mandatory vehicles that the department has to use? And I would say not necessarily so. We do have mandatory use vehicles for kind of, office supplies and PPE, but there is not a, mandate throughout the department that, you must use these contracts. So again, there are category management goals that the department has to reach, but that doesn't take precedent over meeting the small business goals. So just wanted to highlight some of our top contract vehicles here. So simplified acquisition purchases. Again, for those that are new to the department, this may be a strategy that you would want to leverage. So these are for procurements that are valued under $250,000. The department spent about $861 million on simplified acquisition purchases in FY23. These are the top NAICS and PSC codes where a preponderance of that spend took place. And wanted to highlight which optives had the highest amount of simplified acquisition purchases in FY23. So as you can see, NIH, Indian Health Service, as well as the CDC had the top 3 spend relevant to simplified acquisition purchases in FY23. On the right-hand side of the slide, we did kind of poll some of our small business professionals to kind of understand how some of their optives handle their SAT purchases, and you'll be able to find more information about that on this slide. All right, so Small Business Innovation Research and Small Business Technology Transfer Program, also known as SBIR and SITR programs within HHS, our National Institutes of Health Seed Fund and the FDA Technology Transfer Program are the 2 areas where the SBIR and SITR programs sit. So more information you can find on this slide about how you can access information to participate in some of the activities associated with those programs. So with that, I will now transition over to Mr. Joshua Blow, to give us an overview of the HHS Small Business Customer Experience, also known as SBCX.
Good afternoon, everyone. I hope that you all are aware, and if you're not, I hope that you will learn something about how we do business by virtue of this next few minutes going over our small business customer experience portal. This is the place where if you want to know what's going on with HHS and our OSDBU office, what events we're attending, what acquisitions or what requirements we have coming up, this is where you find all that information. So one of the things I'll say before we get started, or before I get into the next slide, is the page that you see before you on the slide now. Once you go to our landing page, which is osdbu.hhs.gov, you'll land on this page. And so one of the things I encourage you to do is to register, create a profile. What's going to happen when you create your profile is it's going to pull your information in your reps inserts from SAM. It will automatically pull into the system. In addition, if you have federal past performance, that information will be pulled into a dashboard that's displayed on your profile. So it's visible for buyers and program officials looking for capabilities to see when they go out and view your profile. So one of the ways that we use the system is our small business directory. So I just talked about creating your profile. If you need assistance with logging in, by the way, you can click on the help menu prior to registering. It'll walk you through the registration process. After you registered, if you want some information on how to update your profile or you're looking for other resources, you go to the help menu and it's completely different. And it gives you some information on how to do some of those other administrative functions related to your profile or profile management. So the small business directory, again, is what we use to find small business capabilities. And I will tell you, we do use this. We do use this as a tool for conducting market research to find your capabilities. You can upload to your profile capability statements, not just one, as many as you'd like, for the NAICS codes under which you primarily do business. I recommend if you've got a couple that you do business under and the requirements are somewhat different to upload a capability statement for each one of those. In addition, when you're completing your profile, as I said earlier, it's going to pull your reps inserts from SAM and it's going to pull in any prime federal past performance that you have. This is a tip for me to you, not necessarily a part of this presentation. I recommend if you do not have federal prime past performance, create an attachment called past performance. And then on that attachment, lay out where you've done work before. A lot of you might be new to the federal space, but not new to the industries that you work in. Provide that information. That is useful information. Ariel just did a slide a few minutes ago talking about simplified acquisition threshold requirements. And that's the kind of information that, although it may not catch a CO or a program office's eye for large prime requirements, if I'm looking for someone to meet a need at the end of the fiscal year for something under the simplified acquisition threshold, that is very useful information. So I would recommend that you add an attachment to your profile called past performance. And also not just your industry past performance, but any subcontract past performance that you have as well, I would include on that handout. Okay, next slide. So our forecasted opportunities, I was looking at this today and I'll tell you that the agencies within the department, August is the month that we reach out to them to have them update the forecast for the following fiscal year. Some of the forecasts, for example, FDA, ACF, and CMS are already updated for FY25. So if you want to know what we're going to be up to for the next fiscal year, for some of the agencies who have already updated their profiles, take a look at it. I think and let me see, there's about 5,200 items on there right now. We're also working with them to make sure that the items on the requirements on the forecast are actual requirements that we're going to be going after for the next fiscal period. So we're not just uploading additional information and leaving old outdated information on there. We're scrubbing it and making sure that all the requirements listed on the forecast are actual requirements that we're planning for the next fiscal period. So stay tuned. It's being updated, but some of the updates are already there. Next slide. Small business tools. So this is a place where you can go on the portal where we try to provide you with some information that you can use on navigating HHS once you're kind of in HHS, specifically related to payment assistance. If you're a small subcontractor for a OTSB or another firm and you got a payment issue, there's a link on there that you can follow to figure out what you need to do to resolve that issue. Our expiring contracts list is there. Someone asked a question in the chat, how do we improve our chances of being considered for contracts with HHS? I think that part of that is that you have to know what we're up to. Ariel is giving you a wealth of information on what we're buying across the department. So know who you're targeting and what they're looking for. And then be specific about how your capabilities align with those requirements, as specific as you can be. So I'm going to move on. And we also have some information on the profile about other opportunities. If you're interested in a specific opportunity, how to reach out to us and let us know what it is which opportunity it is you're interested in. Make sure you provide us with as much information as possible for an opportunity. A description is great. Notice numbers, sources sought notice numbers, RFQ or RFP notice numbers are even better. Points of contact are even better than that. So the more information you have, all the information you have related to the opportunities that you're interested in, please provide that. That really does help us track it down. Next slide. So real briefly, I want to talk about a new addition to our portal is the teaming to the SBCX portal is the teaming partner portal. This is a place where industry creates opportunities for industry. You can post opportunities to team with your industry peers, other smalls. You can be invited to or look for opportunities posted to a dashboard from other than small businesses who are looking for subcontractors to meet those socioeconomic subcontracting requirements. I recommend, and again, this is not something that was originally part of the presentation, but I recommend that if you're interested in teaming for specific opportunities, you could first of all, on your profile, you can make it searchable. Right now, out of over 8,000 firms, I want to say less than 300 firms have profiles that are searchable to OTSBs, primes, and other small business primes looking for partners. I will tell you that we've had large primes reach out to us looking for small business partners. So make your profile searchable so they can find you. Help us help you. So that's what this portal is all about. It's about industry creating opportunities for industry, making connections to form teaming arrangements, whether it's at the sub, joint venture, or whatever level it's going to be, and all to generate more opportunities or create more opportunities for small businesses to provide to meet some of the requirements within the department. Next slide. So that is the end of our presentation. I know I went over the SBCX portal really briefly. I do have a much more in-depth presentation that I can give that I may be giving throughout the year. Pay attention to the SBCX portal on announcements for upcoming events like our vendor engagement sessions, which we hold on the second Tuesday of every month. They're 15-minute capability briefings, and our office hour sessions. And some of those sessions are training on the portal. So keep an eye out on the main page of the portal for announcements for upcoming events. Thank you all. And that's it.
Thank you. I really appreciate your guys' time today. I know that Ariel has been in the chat and answering some of these questions. For those of you who are curious about the recording and the presentation will be posted on our website along with other past webinars by the end of the day. And I know we're at time now, so I don't want to keep everyone, but if you do have any additional questions, please do not hesitate to reach out to us at events@national8aastociation.org. We're more than happy to jump in and facilitate any questions. And thank you again for everybody's time today. This concludes our webinar, and we hope you'll join us next month.